So you say we don't need regulation. I say without regulation, what we have are the old medicine men selling us garbage drugs. We have grocers selling us poisoned meat because we don't have any inspectors. We have children working in mines because we don't have any regulations about that. I mean, do you know, have you ever met any of these business people? They're rapacious. They will do whatever they can to make a buck. Doesn't matter if it's right or wrong. They will do it. And if the government's not there to stop them, they're going to go ahead and do it.
Okay. The first is, we allegedly live in a land with a lot of protections, and yet we know that, for instance, many people die of drug overdose in this country, and most of those drug overdoses are from prescribed medicine. So we know that happens all the time, right? So if the concern is rapacious drug companies, businessmen, taking advantage of people, and that's the case, and the government is here to protect us, why is the government going after the drugs that don't kill us, but allowing the drugs that do kill us? I mean, the statistics is that no one's dying of marijuana, for instance, but many people are dying of painkiller medication. So that's an interesting problem. There's a lot of things that people die of. There are risks everywhere, and people have to navigate those risks. This idea of a risk-free life seems strange to me. What we need to do is make people responsible for their actions.
So every man for himself.
Well, wait. I didn't say that. I said everybody responsible for their actions. So when people try to get away with something by fraud, they should be and be prosecuted. That's entirely reasonable. That's what the rule of law is for. Regulation doesn't do that. Regulation starts saying, oh, we know better than you ever will know what you may or may not do or take. So that means that we, the government, the people who graduated from college and been employed by a bureau, we know, and we'll tell Congress if they ever read the code that we produce. We know what's best for Americans, and we'll make it very expensive to get anything done in the areas that are under our control. So drugs are dangerous. So we make some illegal outright. We make other ones legal only, through a Byzantine prescription system. Well, I mean, that's one of the weird things about the government protecting us. Okay, let me start over again. The weird thing about getting government to protect us from our own bad decisions and other people's perhaps irresponsible, perhaps fraudulent attempts to help us. I mean, there's a lot of people out there like that. And of course, a lot of people, just mistakes get made. We make things so complicated and so expensive, and then we worry so much about things that we have people dying in pain because we refuse to give them help. Okay. Yeah, because the pain medication might be dangerous. I have a friend whose father wouldn't let his wife get pain medication in her last days in cancer because she might get addicted. That mentality, that's not the government. That was just pure folly and cruelty. But the government has that same attitude when it basically won't let people get the kind of pain medications. My doctors will take any new patients except pain management patients.
Why not? Why won't they take pain management patients?
Because pain management patients are the ones that can put them in prison. Because it's pain management doctors who the federal government is attacking. Because the federal government, you see, knows much better than doctors and patients what drugs patients should be taking. And if the doctors do something that looked bad on some sort of recipe for a cure, they'll take them and put them in prison. They put many doctors out of business simply because they've run afoul on pain medication elements. I just think people should actually learn from their own mistakes and others' mistakes, and we should start have a gimlet eye on all aspects of the problem, including government. Making government protect us over and above laws against force and fraud and the rule of law, but by regulating in advance and making government businesses then go through so many hurdles that they can now get away with charging huge amounts of money for new medications. the whole prescription drug racket now is so bad and so dependent on huge amounts of money from Medicare, Medicaid, and the major insurance companies that anyone who who isn't really poor or really rich or have a really good insurance policy basically can't take the medications that would help them.
See, I hear that all the time, but then I know that countries that have humane medical care for their citizens, like Canada or France or a lot of the European countries, in fact, have really cheap medicine. I mean, how is it that they manage to have such cheap medicine while America has to have these outrageously high cost medicines? Sorry, I'm drinking whiskey, so my
well, that's actually the most interesting. That's the most interesting question that you could ask an economist. And when an economist were here, he would answer, perhaps in a provocative and interesting way. What I will say, as a historian of economic ideas, what I will say is that it appears to be that the various socialist and quasi-socialist welfare states of the world, have set up a system in collaboration with the U.S. government and its patent policies to set up a two-tier market system. And what they have is that the drug companies, the FDA is the most oppressive regulator of new drug development. Nevertheless, in America, we have the most drugs being made. And why or it wasn't until very recently, the most drugs being made in any country. Why is this? Because we also have this goofy subsidized system that helps people get drugs through our weird system of insuring and by third-party payers and by governments. And so you have this subsidy system, patent system, and then you have all the rest of the other countries that make these lowball bids on drugs, so that the drug companies make their money they make the bulk of their money off of U.S. patients.
The richest country in the world.
The richest country in the world. And the richest patients. And of course, that's what our patients are, generally the richest patients. Almost anybody who works in a good company who has a really high-grade insurance policy, or was on Medicare, or some degree on Medicaid, their drugs are paid for, and were until Obamacare.
Well, and the drugs in Canada are paid for, and the drugs in Europe.
Yeah, but the ones in Canada and these other countries, they get lowball prices, where the drug companies in America then are able, this is really interesting, then are able to sell them really cheap and make a marginal gain. So it pays them to make a little bit off of the world market. But they make a lot off the American market. And this is not because markets are doing this or because of free markets. There are no free markets in any of this. This is all heavily regulated by every government of the world. So this is basically a whole bunch of trade policies and subsidy policies coming together to screw Americans over. Now, why does this happen? Because, of course, we have lawyers in Congress who don't understand economics, but they certainly do understand who pays their re-election campaigns. So if you want to get cheaper drugs in America, you basically have to break down the barriers on where drugs can and will be sold. You have to lax up and maybe get rid of the FDA's strict controls on new development. And maybe we could get rid of the patent system in drugs too, because the patent system allows some remarkably weird practices to occur. And the patent system is not really a part of the free market as such. The patent system is kind of like slavery. You know, libertarians and laissez-faire economists tend to be for private property, but we're not for private property in other persons. And private property and easily copyable ideas doesn't get a lot of support from them either. And there's a reason for that. It's kind of false property. It's the kind of property you can make if you have the inside track. And America is kind of an insider economy, and it's a very weird one. And I don't want to defend it. In fact, when you see something going wrong in this country, it's probably because the government has messed it up.
So what would happen if we just socialized medicine and demanded that, like other civilized countries that provide health care to their citizens, we just made it a law that these drugs had to be a reasonable price?
A lot of things would happen, and a lot of things are happening. I mean, you would get a great deal of rationing by weighting. This is a norm in Canada, a norm in Great Britain, surely. Europe does not have a pure, most European countries do not have a pure socialized system. And it's not the dreamboat system that progressives lie awake at night masturbating to. It's quite complicated in many cases. It varies from country to country. Some work better than others. And some things get provided nicely and other things get provided hardly at all. Things that we in America take for granted now. For instance, almost instant, you can get a CAT scan or an MRI very fast in America, and getting treatment for diseases or even getting diagnosis for a bad disease happens within a month. I mean, you can do a lot of things really fast in America, whereas and it could be even faster if we had less regulation than we do now. I mean, we have a lot of regulation of medicine in America. The most important one is that we have the states almost uniformly reduce the amount of hospitals that are available for the population. In fact, hospitals get to regulate entrance into the market, just like doctors in America get to regulate entrance into the market. There is a huge amount of regulation that constricts supply, and anytime you constrict supply, you increase the prices for those things. And hospitals now engage in practices that would never occur on the free market because they're just so exorbitantly idiotic. But we have a hugely rigged system. Socialism is just rigging it all through the government. And if you want to see how socialized medicine works, just go down to your VA. How effective is the VA? It's really great for some people with some diseases, but for the bulk of people who have the really bad stuff, it's really a crapola system. It's a hit or miss kind of thing. You have lots of people falling through the cracks when socialism is designed not to have anybody fall through the cracks. But that's exactly what you have in a socialized medicine system. Canada has kind of an interesting idea.
Canada has an interesting idea.
Well, Canada's system is interesting as far as I can tell, in that a lot of the payment for their medicine system comes from the sale of petroleum and other mineral resources.
And this is true of a lot of the famous European countries like Sweden and...
Well, Norway, especially.
Norway.
Norway gets a lot of their stuff because they have these huge oil reserves, and basically just tax the hell out of it, and the people get the benefit. It's like what's happened in Arabia and other countries, except, where the Sultan of Brunei just gives people stuff because he has so much oil, he doesn't have it, and therefore he has so much money, he barely knows what to do with it.
Socialism has been made practical in countries with high resource countries.
Yeah. However, it's not really practical because it has a whole bunch of downsides. Sweden is I think, as far as I can tell, it was a real mess, and I think people should look into what's happening in Sweden right now before they start extolling the wonders of Scandinavian socialism.
What's so wrong with socialism, though? So, don't you want a state that tries to take care of its citizens? And
no,
what's wrong with that?
No, because the state that can take care of you can destroy you. The state that has that much power is a state that is controlling everything, and I don't want to be controlled that much. There's a problem of mission creep that in all states is that they tend to start doing they get involved in everything. But of course, in Europe, they're not doing everything because the United States protects much of Europe so that they don't grow they don't really defend themselves. There's a lot of Europe that would otherwise have a lot more money going into defense, and their social welfare programs. The good example is France, of a country that is really socialistically minded on many levels. They have a socialist in office. Their tax rates are going through the roof, and their protections for workers, these beloved protections from workers from the rapacious businessmen, are so extensive that the unemployment rates are just gargantuan. I mean, we have horrible unemployment in the United States, but we have nothing compared to how bad it is in France. And even the socialistically minded progressive new Nobel laureate in economics, he's come out recently, and he's not really much of an economist as far as I can tell. He's done his weird little things in econometrics, but even he realizes, I mean, the only way for these welfare states to work is to stop trying to do everything. You can only do some things. This is one of the things that anybody who's really understands management should know. If you've ever worked for a corporation, you should know. If you've ever tried to, I think everybody should try to organize a community of volunteers and then try to start talking about what the government needs to do. Because as soon as you start talking about managing people, all of a sudden you realize that it's hard to organize people to do lots of things. Doing one thing and doing it well is a wonderful miracle of organization. That's one of the neat things about businesses in America or anywhere, is that they have goals and they have a certain product line that they're working towards, and they push through it, and then they have the profit and loss statement. Have they succeeded or not? If their cost exceeds their revenues over a long enough time, they just go out of business, and somebody else tries to do something a little bit different. They figure out a way to get it done, or it doesn't get done. And states are not allowed to fail, and therefore they have failure built into the everyday life. Socialism doesn't work because it tries to do everything.
Well, you libertarians talk about leaving people free to do whatever they want. What if the majority of people want a socialized state? They want a state in which the government takes care of them. It takes care of their medical needs, looks after them. What if that's what the majority of people want? Do the libertarians say, no, you can't have that?
Well, let's do in a sense, that's what we have. Is we have a majority of people who think that the government should save them from A, B, and C. The question is, do we have the government save them from D, E, and F? Or is it G, H? How far does the government save them from something rather than them figuring out some way of doing it on their own? That's an interesting question. How much government do we need? How much do people want? But libertarians usually do a little thought experiment. You say the majority of Americans, they want socialism so desperately. I don't think that's true. In fact, if you were to put socialism up for a vote, Americans would vote it down. Okay, let's be realistic here. It's not a majority of Americans who want socialism. It's a minority who thinks that they can get the majority to go along with them if they package their ideas in a certain way. That's the truth. So let's be very realistic here. But other than that, the question is, if the majority of people want to kill all the Jews, who are just obviously a smaller minority, why shouldn't they do it? The answer to that question gives you the answer to why libertarians don't want the majority of people getting what they want. That's a really simple question. There are principles involved. There are limits to what we may do. Libertarians are very concerned about those principles, and we're very concerned about what anyone does to anyone else against their will. Socialism is doing things to some people against their will. That's what it is. That's the system depends on that. Whereas in the distributed, decentralized organizational systems of a free society allow people to live freely and adapt to the others and cooperate voluntarily. That would be the main way that people would cooperate. And that just seems to us so much better. I don't really understand how people think that being regimented by the state and told by the state what they may and may not do is somehow preferable.